Hi guys, I want to start part two of this three-part lecture. In the previous lecture on exercise hydration, we talked about the challenges of exercise, specifically with regards to core temperature maintenance and how fluids fit into that mix, and also nutrient and how um, depletion of our own stored nutrients and replacement via drinks was vital. So when we start this section, we're going to talk about um, a little bit more about the drinks themselves. And that should you choose water or should you choose a carbohydrate electrolyte beverage? Um, why and when? So, and I've divided this up into two bullet points. The first being water and a low sodium carbohydrate electrolyte beverage. And you say, well, why high and low sodium? They both have carbohydrates. And that the reason being is because large volumes of fluid that have less uh, sodium content than our bodies will lead to a dilution of body sodium. All right, and this is the problem that's been associated with a lot of marathoners that we've seen over the past few years is that they're drinking water on the run, and in a matter of a few hours, they've developed a condition called hyponatremia, and which can be life-threatening. You remember from the previous lecture, I talked about your brain swelling, and this is essentially what happens is diluting body sodium by drinking water. So think about it this way. We're losing fluid and sodium via sweat, yet we're only replacing with water, or we're replacing with a low sodium carbohydrate electrolyte beverage in that the amount of sodium that we're replacing is far less than what we are losing via sweat. And what happens is that our total body sodium dilutes, all right? And that we have a shift in fluid. And that fluid will cause our cells to swell in a condition what's called hyponatremia. And in your brain, again, this can be life-threatening. All right, so drinking large volumes of water or a low sodium carbohydrate electrolyte beverage can cause hyponatremia. It's called acute dilutional hyponatremia when you drink something and you get this condition, all right, via dilution of body sodium. Well, remember we talked two different ideologies, drink to thirst and drink to schedule. For these reasons, dilutions of body sodium and hyponatremia, it is best with these type of beverages to drink to thirst. Why? Because by drinking to thirst, yes, you are going to be, you're not going to be drinking as much fluid, but what that means is that it's going to decrease the dilution of body sodium. But since you're drinking to thirst, it's going to limit plasma losses. In other words, the thirst mechanism is going to kick in when our blood starts to become too thick or hypertonic. And we're going to start to get thirsty. So now that is by consistently drinking to thirst, it's going to prevent us from getting too hypohydrated, or the process is called dehydration to hypohydration. So it will limit plasma losses. So you will be hypohydrated, all right, because you're drinking to thirst. However, you will not have the same risk of hyponatremia because you are not diluting your sodium at a great rate because you are not drinking water and low sodium on a schedule. So drinking to thirst, you'll wind up drinking less. All right? But the problems go beyond decreasing, or the problems go beyond preventing hyponatremia in terms of performance, because Drinking to thirst is going to allow you to be hypohydrated and maintain a certain level of hypohydration, which you may not be in danger of death due to hypohydration, but you may be in danger in terms of performance deficits due to hypohydration. So even though that we are decreasing the sodium dilution rate by not drinking enough, we are essentially hypohydrating or dehydrating ourselves into a state of hypohydration, which can reduce performance, all right? Not just reduce the risk from hyponatremia. With a high sodium carbohydrate electrolyte beverage, this is not as big of an issue because we are replacing sodium at a high enough rate that allows us to drink larger volumes of fluid, in this term, and this being a high sodium carbohydrate electrolyte beverage, without diluting body sodium to a significant degree. What this also allows us to do is to keep up with or better limit plasma losses and, if not, maintain what's called euhydration, or a normal state of body water, versus being hypohydrated or dehydrated to hypohydrated. So high sodium carbohydrate electrolyte beverages will allow us to maintain plasma volume due to higher drink rates, right? Because they are safer to schedule, all right? And also limit the use of stored carbohydrate, maintain glycogen, because we are now feeding ourselves with carbohydrate on a schedule, which just so happens that when you're exercising, you are burning carbohydrates at a consistent rate. There are no breaks in between unless you stop exercising, but then your body is still burning through carbohydrates. But as long as you are exercising, it's a pretty consistent rate of burn. And so it is conducive that we try to keep up with that rate of burn to keep our glycogen to being overutilized. All right, and so by drinking to a schedule, which we can safely do with a higher sodium carbohydrate electrolyte beverage, we are also able to limit glycogen utilization by increasing the amount of carbohydrates delivered in our bloodstream and ultimately to our muscles. All right. One of the other benefits of carbohydrate electrolyte drinks above that of water is that carbohydrate electrolyte drinks are able to hydrate faster because they use multiple transport mechanisms in our small intestine to basically upload that water into your blood. All right. And again, high sodium carbohydrate electrolyte beverages will limit sodium losses because there's more sodium being delivered. So in terms of scheduling, high sodium carbohydrate electrolyte beverages are safer to consume via scheduling. They are more conducive to performance by minimizing glycogen burn and maintaining plasma volume. All right. However, in terms of water or a low sodium carbohydrate electrolyte beverage, drink to thirst makes more sense because we do not want to dilute our body sodium and potentially suffer from the condition called hyponatremia, which could be life-threatening. So how prevalent is hypohydration, or a state of reduced body water? Well, very common. All right, 2% or more are very common during endurance training and competition. You can check this yourself via measuring your body mass losses after exercise and how much you consume. So for example, if you have a 75 kilogram athlete, he loses a 1.5 kilogram loss. That's equal to about 3.2 liters of fluid. All right. So 2% of 75 is 1.5. 1.5 kgs of fluid, body fluid, is equal to about 3.2 liters of body fluid. So 3.2 liters in terms of a 75 kilogram athlete is a 2% loss. So let's see how this works out in terms of an example here. This person exercises for 3 hours, sweats at about 2 liters per hour, which is not extreme, but is a fairly high sweat rate. You might see this in terms of either an intense exercise session or in a hotter environment, right? And so 3 hours times 2 liters per hour is 6 liter loss, and that during exercise. During this exercise, the person drinks 600 milliliters an hour, which is the size of a small water bottle. So if this person consumes 600 milliliters per hour, that's a 1.8 liter gain. So if you want to do the math here, 6 liter loss, 1.8 liter gain means this person is 4.2 liter deficit, which means that a 4.2 liter deficit is a greater than 2% loss. So during this example, this person will have lost more than 2% of their body mass by drinking only 600 milliliters per hour, or a small bottle that is typical on your bike. All right, one small bottle per hour, all right, will result in a greater than 2% body mass loss. All right. Well, what are the problems with a greater than 2% body mass loss? Well, literature suggests that body water losses as small as 2% can be detrimental to performance. So beyond just the survival perspective, your performance can decline. And this is not only in terms of endurance performance, but also dehydration or hypohydration from dehydration can lead to strength deficits as well. And the drink to thirst mechanism does not address performance, and because it does not limit body water loss to an extent that is going to kind of stave off performance deficits. However, it does address the hyponatremia, the problem of hyponatremia, by reducing the reduction of body sodium by not drinking as much. All right. So, in terms of performance or losses for performance from 2% body loss or greater, specifically, what type of decrements do we see in or variables in performance? Well, there's that increased thermal strain, perceived exertion, decreased VO2 max. We also see a decrease in nerve conduction speed, so you simply cannot fire your muscles as fast. So for all you sprinters, not good. Stay hydrated. And here's a big one, an increased reliance on carbohydrates. So being dehydrated, or excuse me, being hypohydrated, dehydrating to a 2% or greater hypohydrated state will, your body will rely on an increased dependence of carbohydrates, what is relative to being euhydrated. What does that mean? That means that you're going to burn through glycogen faster. What does that mean? That means that you're going to bonk faster. So staying hydrated, all right, not only staves off problems with regards to thermal strain and perceived exertion, decreased VO2 max, but also helps you burn fat. All right, and that alone, staying hydrated, can stave off that bonk. All right, so not just providing yourself with enough carbohydrates, but also staying hydrated can fend off that dreaded bonk. All right. that concludes that part. We'll move on to part 3 next.